Welcome to the deep dive. Okay, think about this for a second. Your medicine cabinet at home.
Oh,
You probably have some non-steroidal anti-inflammatory drugs, right? NSAIDs.
hmm
We all use them for aches, pains. But today we're kind of flipping that around. We're looking at how these really common meds can be, well, unexpectedly dangerous for our pets.
exactly. We've been digging into the veterinary literature, the expert stuff, really getting into the details of NSAID toxicosis in animals.
Right.
So think of this as your essential guide, giving you the knowledge you need to protect your pets, whether they've got fur, feathers, or scales.
Okay, let's jump right in. NSAID toxicosis.
Hmm.
What exactly does that term mean?
So simply put, it's poisoning. It happens when an animal swallows too much of an NSAI. That could be like one accidental overdose or maybe smaller amounts given over time.
Okay.
And, NSAIs aren't just one thing. It's a whole family of drugs. We can kind of group them by their chemical structure.
Interesting. So, like, what are some common ones we might know?
Yeah, so you've got carboxylic acids. That's things like aspirin, ibuprofen, naproxen, probably ones you have at home,
Mm-hmm.
but also some vet-specific ones like carprofen. Then there are enolic acids, phenylbutazone, meloxicam, piroxicam.
Okay.
And then the newer ones, the selective COX-2 inhibitors, like dirocoxib and firocoxib.
So, quite a range. Does that mean some are, riskier than others for pets?
Well, it's interesting. Those newer ones, the selective COX-2 inhibitors, they're designed to be more targeted, sort of like smart bombs for inflammation compared to the older ones that hit more broadly.
Oh,
So generally, they might have fewer side effects
right.
because they're less likely to mess with something called COX-1, which has a protective job in the body. But, and this is really key, they're definitely not risk-free for pets.
Right.
The wrong dose, giving it when you shouldn't, that can still cause major problems.
Makes sense. More targeted isn't zero risk.
Yeah.
So, how do these actually work? Reduce pain and stuff in us and critically in our pets.
Okay, so the core mechanism is blocking enzymes. They're called cyclooxygenases, or KOX for short.
GOX. Okay.
Think of KOX enzymes as little factories making signals for pain, fever, inflammation. These signals are called prostaglandins.
Right.
So NSAIDs interfere with KOX. They block it and basically turn down the volume on those pain and inflammation signals.
Okay, I follow the basics there. But if they work similarly, why are they so much more dangerous for, say, dogs and cats?
Yeah, this is the really critical point. Animals usually absorb NSAIDs well when they take them by mouth. No problem there. The big difference is how their bodies break them down and get rid of them.
How so?
Compared to humans, dogs and cats clear these drugs out much, much more slowly.
Ah, so they just hang around in their system longer. That sounds like it could be a problem.
Exactly. That's the crux of it. They get processed in the liver sometimes into stuff that's still active, sometimes inactive, and then they leave the body mainly through the kidneys or in bile. But because that whole elimination process is so sluggish in many pets, the drug can build up and build up until it reaches toxic levels.
Right. So, okay, we know the types, how they work, how pets handle them differently. What damage can they actually do? What parts of the body are most at risk?
Unfortunately, several really vital systems can take a hit. The GI tract, the stomach and intestines, that's a major one. Big risk of erosions, even deep ulcers.
Wow.
Then there's the blood and immune system. Some NSAIDs can mess with platelets, things that help blood clot, so potential bleeding disorders.
Okay.
The liver is another worry. Sometimes you get this what we call idiosyncratic liver damage. It's like a weird, unpredictable reaction in the liver itself. And very importantly, the kidneys. Big risk there. Acute kidney failure or something called acute interstitial nephritis. Really serious stuff.
That paints a pretty serious picture. Are some animals more vulnerable than others? Like a tiny chihuahua versus a big dog?
You're absolutely right. The differences between species, how they absorb, break down, get rid of NSAIDs, they can be dramatic, really dramatic.
Okay.
And that's exactly why you can never just guess a dose or assume what works for one species or even one breed will work for another. It's non-negotiable.
So giving our pet like half of our own painkiller is a definite no-no.
Oh, absolutely. A massive red flag.
Yeah.
Giving an animal an NSAID that wasn't specifically prescribed by a vet or giving the wrong dose, it can be incredibly dangerous, even fatal.
And cats are especially sensitive, you mentioned.
Particularly sensitive, yes. And those common over-the-counter drugs, we all have ibuprofen, naproxen. They're very frequent causes of poisoning in dogs and cats. Naproxen in particular is tricky because it has a really, really long half-life in pets. It just sticks around in their body for ages, which ramps up the risk of serious side effects significantly.
Gosh, it's actually quite scary how easily someone just trying to help their pet feel better could accidentally cause so much harm. Is this a common problem? Do we know how often it happens?
Unfortunately, yes, it's far too common. NSAID toxicosis consistently lands in the top 10 reasons people call animal poison control centers.
Wow, top 10.
Yeah. That statistic alone really tells you how widespread this is and why it's so vital for pet owners to know the risks.
Okay, so knowledge is key. What are the signs? What should you be looking out for if you suspect your pet might have gotten into some NSAIDs?
Okay, so the first signs are often GI-related, stomach upset, things like that. They can show up pretty quickly, maybe within a few hours.
A few hours, okay.
But kidney problems, or maybe more serious ulcers, those might take longer, sometimes a couple of days to become obvious.
Right.
And of course, if you know your pet might have eaten some pills, that's critical info for the vet. Beyond that, look for behavioral changes. Are they suddenly really tired, lethargic, off their food?
Actual physical symptoms. What might we see?
Vomiting is a big one. You might even see blood in the vomit, which is obviously very serious. Diarrhea is also common. And watch their stool. If it looks dark and tarry, like coffee grounds, that's called melena. It means there's digested blood from higher up in the gut. In worst cases, you might see jaundice, yellowing of the skin, gums, eyes. Severe cases might involve collapse or even, tragically, sudden death, often if an ulcer perforates, bursts through the stomach wall.
Oh, God.
And with kidney involvement, you might first notice they're drinking a ton and peeing a lot. But then, worryingly, that can switch to peeing very little or not at all.
Okay.
And with really high doses, you could even see neurological signs: stumbling, being uncoordinated, seizures, even coma.
That is a really wide and concerning range of signs. If a vet suspects NSAID poisoning, what might they find during their physical exam?
Well, they might notice the pet seems depressed, just not themselves. Their gums might look pale, suggesting anemia perhaps. Their belly might be painful when touched. Signs of dehydration are common too. Maybe a fever, maybe a really fast heartbeat. And like we said, potentially jaundice.
So we know the risks, the signs. What usually leads to this? Is it always just, a dropped pill?
Accidental exposure is definitely a big one. Pill falls on the floor, pet gobbles it up before you can react. That happens a lot.
Yeah.
But also, unfortunately, owners meaning well, but giving human NSAIDs to their pets, thinking they're helping with pain, but actually causing serious harm because they don't understand the dosage differences or the risks.
Right. And are some pets just naturally more at risk?
Yes, definitely.
Mm-hmm.
Older animals, for instance, pets that already have kidney or liver problems or maybe heart disease, animals with low blood pressure, or pets that are already sick with something else or on other medications. Very young animals, puppies and kittens, can also be more sensitive. And this is really important. If an animal has ever had stomach ulcers or bleeding before, they're at much higher risk if they get exposed to NSAIDs again.
Okay. So let's say the worst happens, or you suspect it has. What's the immediate reaction? What should someone do, and what happens next in terms of diagnosis and treatment?
First thing, if you think your pet ingested NSAIDs, especially recently, like within the last hour or two, call your veterinarian or an animal poison control center immediately.
Don't wait.
Do not wait. And don't try to make your pet vomit at home unless a vet specifically tells you to. Sometimes that can actually be harmful.
Right.
At the clinic, if it's safe and appropriate, the vet might induce vomiting. Then they'll likely give activated charcoal. It acts like a sponge, basically, to soak up any drug left in the stomach or intestines.
Okay.
Sometimes they'll give a cathartic, a laxative, to help move things through faster. But usually not if the pet already has diarrhea.
Makes sense.
And for some specific NSAIDs, the ones that can get reabsorbed lower down, they might need repeated doses of that activated charcoal over time.
And beyond getting the drug out, what kind of supportive care is needed?
Oh, supportive care is absolutely vital. 4V fluids, intravenous fluids are usually started right away, especially critical if there's vomiting or dehydration, or if there's any concern about kidney damage. Fluids help support the kidneys.
Right. Fluids are key.
Definitely. If there's been significant bleeding and the pet is anemic, a blood transfusion might even be necessary.
Wow.
And then there are medications specifically to protect the stomach and gut. Things like H2 blockers, famotidine, ranitidine, or sucralfate, which kind of coats the stomach lining. Misoprostol can also help protect the stomach. Or proton pump inhibitors like omeprazole to cut down on stomach acid.
Lots of options there.
Yeah. And if, say, acute kidney failure develops, they might use drugs like dopamine to try and support kidney function. If seizures happen, anti-seizure meds. And sometimes if a pet is comatose, they might try other things just to rule out different types of poisoning.
How long does all this treatment usually take?
It really varies. Depends heavily on which NSAI it was, how much was ingested, how badly the pet is affected. Some might just need a day or two of care. Others with serious kidney issues or bad ulcers might need longer hospitalization.
When is hospitalization pretty much guaranteed?
Generally, if it was a large dose, or there's a known high risk to the kidneys for that particular drug. Or, of course, if the animal is showing severe signs, constant vomiting, bloody vomit, that dark Tory stool, significant anemia, or any clear signs of kidney failure.
Right.
Milder cases, maybe a very low-dose exposure with minimal signs, might sometimes be managed at home, but only with very close veterinary supervision and clear instructions. Never just assume it's okay.
Okay. Are there any other really crucial things to keep in mind, like combinations of drugs to absolutely avoid?
Yes, absolutely. A
Yep.
golden rule, never give corticosteroids like prednisone at the same time as an NSAID.
Never. Why is that?
That combination massively increases the risk of severe gastrointestinal ulcers and bleeding. Just don't do it. Also, NSAIDs generally aren't safe during pregnancy, potential harm to the fetus.
Okay.
And you need extra caution if your pet is already on other drugs that can be tough on the kidneys, certain antibiotics, maybe ACE inhibitors for heart conditions, things like that.
Interactions.
Exactly. And since many NSAIDs bind tightly to proteins in the blood, they can potentially interact with other drugs that also do that. So always tell your vet everything your pet is taking.
Good point. So during recovery, I assume close monitoring is essential.
Absolutely critical. Watching urine output is key for kidney function. Owners need to keep a close eye on stool and vomit for any hint of blood. And regular blood tests are standard practice during recovery, specifically checking kidney values like BUN and creatinine to make sure things are heading in the right direction.
This really all circles back to prevention, doesn't it? What are the absolute key things pet owners need to do?
Number one, without a doubt, store all medications securely. Prescription, over-the-counter, yours, your pet's, everything, out of reach. Child-proof containers, high shelves, locks, cabinets if necessary. Pets are ingenious at getting into things.
So true.
And number two, I know we've said it, but it bears repeating. Never give your pet human medication unless your vet explicitly tells you to, including the exact dose. Don't guess. Don't assume. Just don't. And maybe a third point. If your pet is in a higher risk group, or if your vet is considering putting them on long-term NSAID therapy for something like arthritis, doing some baseline blood work first to check their organ function is often a really good idea.
That makes a lot of sense. So finally, what's the general outlook? If a pet does get NSAID toxicosis, can they recover fully? Are there lasting problems?
Well, while really severe complications can happen, like a perforated ulcer needing surgery or irreversible kidney damage, the good news is that the prognosis is often quite good if treatment is started quickly and it's appropriate.
That's encouraging.
Yeah. GI upset usually clears up completely with the right care. Kidney damage is often reversible, especially if caught early and treated aggressively. Liver issues also tend to resolve once the drug is out of the system and they get supportive care. So prompt action makes a huge difference.
Okay, definitely good to end on that more positive note.
Yeah.
So just to quickly wrap up the absolute must-knows from this deep dive, NSAIDs, even common ones, carry real risks for pets because their bodies handle them so differently. Secure storage of all meds is non-negotiable. And always, always follow your vet's advice. Never give human meds without their okay.
Exactly. And maybe just one final thought for you to take away. Seriously, maybe right after this, take 5 minutes. Go look at where you keep your medications. All of them. Are they truly inaccessible to your pets?
Good challenge.
Because even what seems like a tiny dose of an over-the-counter painkiller to us can have devastating effects on them. It just underscores why we need to be so vigilant and why professional veterinary advice is absolutely essential.